So the second approach I want to tell you about is called open dialogue. Now, open dialogue was developed in Finland, in a small town in northern Lapland, town of Tornio, Finland. And it was started about 30 years ago by a psychiatrist named Hakko Sekala. And I think, well, anyway, if you want to find out about it, open dialogue is the name of it. Okay, so what did they do in Finland? In Finland, they set up a system where if anybody is experiencing psychotic symptoms, which the main psychotic symptoms are hallucinations, hearing voices that other people don't hear, seeing things people don't see, feeling things people don't feel, hallucinations, then delusions, believing things that no one else believes, that are totally out of keeping with consensual reality, believing things that are kind of hard to believe, delusions, and then disorganized thinking. Those are the positive symptoms. The negative symptoms of schizophrenia are catatonia, total retreat, not talking, not engaging with anybody. Those are so-called negative symptoms. So at the first sign of symptoms in this area of Finland, somebody will call the hospital. And when that happens, a team of 2 professionals from the hospital, 2 or 3, will go to the home within 24 hours if it's a crisis, and within 48 hours, period, no matter what. They go to the home, they meet with the person who is experiencing these symptoms and the family, and they set up a series of meetings. They ask the person, who would you like to come to these meetings? We're going to meet every day or every other day for 3 weeks. And so they do. They have meetings, parents, siblings, boyfriends, girlfriends, spouses, coaches, mentors, teachers, uncles, grandparents, anybody who cares about this person is invited to be at the meeting. And the professionals create an environment in that meeting where people really feel free to talk about anything. They have this idea that we don't know what happened, and we just want everyone here to be free to talk. Tell your stories, tell what you think might have happened, your own stories about the family, whatever. So the whole idea is we don't know what happened. Let's talk. Let's hear everybody. And let's just go wherever we go here. We're curious. We're going to see what we can learn from each other. Every once in a while, the professionals will stop the conversation and they'll talk among themselves. And they'll say things like, you know, I'm really interested in what so-and-so said. That really interests me. I think that there's something there that we ought to look more into. And I'd like to hear more about that. And you know, I think the patient, it would really be great if a patient would think about what so-and-so said. That might be very useful. They'll just talk among themselves, and then they'll go back and open it up. And the basic idea is let's have such a open atmosphere and a welcoming and a curious atmosphere that things that have never been said before will be said in this family. All treatment decisions are made in the presence of everybody. Again, drugs are not the primary modality of treatment. Again, about half of the patients have been on a drug at one time, but a small percentage are kept on the drugs. Once a patient is there, is a patient of that hospital, they're a patient for the rest of their lives, if they want to be. They don't hand off. They maintain continuity of treatment with that family. So, in Finland, they report an 80% full recovery rate, folks. 80% full recovery from first episode psychosis. Now, that's unheard of in this country. In fact, the recovery rate from schizophrenia hasn't improved in this country since 1900. Now what's happening? Now open dialogue has been introduced into the United States. There's a woman named Mary Olson who's training people in open dialogue. So in Western Massachusetts, Burlington, Vermont, Atlanta, Georgia, San Diego, New York City, open dialogue is being used in this country. And anybody who wants to get trained can get in touch with Mary Olson and get trained in how to do this. Of course, it's going to be different here. We're a different country, but it's going to be introduced, that idea about how to work with a family, how to create that kind of approach.